Hi, I'm Shannon Griffin, and you're tuned into Chatterbox here at Hospital Radio Medway. In this second of 2 episodes, Jayne Black, the Chief Executive Officer of Medway NHS Foundation Trust, talks about her management style and approach and the initiatives that she's spearheading to support the 5,000 staff who work at the hospital. She also discusses the impact of the hospital's patient-first methodology, and we find out a little bit more about the woman behind the title. Welcome to part 2. Tell me about the staffing here at the hospital. And I imagine one of the challenges that organisations such as this are faced with is, keeping good staff and maintaining morale. And I think you perhaps have an environment in this building that can work against you in that regard.
Absolutely.
So how do you overcome those challenges, and how's it working?
We've got about 5,000 staff now. We have increased the number of permanent staff over the last year or so. If you looked at our vacancy factor last year, it was about 10%. It's now down to about 2%.
So how have you achieved that?
I think there was a number of things. I think many people, perhaps listening internally, will know about our strategy for our organisation, which is around patient first. And that is true. We must put the patients first, and our strategy and our vision and our mission is all about getting us to that point. And so in order to support that, we've been using an improvement methodology, which we've now rolling out across the organisation. And what that does is allow people at the front line where, they're working with patients and they're caring for patients to put in the improvements that they think are the best things to do. And so that gives people that engagement and the empowerment, if you like.
So you're giving them a little more autonomy.
A bit more autonomy
to
change things that actually mean something to them and something to their patients locally. And I think that's important. We haven't got it right across the organisation yet.
Yeah.
It's 2 years in the making.
Okay.
And we have a conference on the 9th of July, just lugging that one, for 2 years now doing patient first. And people are going to present the work and the improvements that they have done because they're proud about what they've done. So I think there's something about using that in terms of looking after staff. I think we've got to do a lot more. We've got quite a diverse workforce.
Yeah.
And I think we need to, certainly from my perspective, it's about everyone is equal in this organisation. And I think we've still got some work to do around that. And I want to work with people around that, what that means and how we can make sure that there's, equality across the piece.
Yeah.
And that's not an easy thing to do. But I'm very clear that's one of our top priorities around how we do that. And we have seen that our staff engagement scores improve over the last couple of years. They're not where we want them to be, but they definitely have improved. And the more we can ask people and then try and support them, the better it will be.
And I guess that autonomy of being able to staff feeling that they have got a contribution to make and they're allowed to put their ideas into action must be a more motivating place for them to work. I would
hope so. It certainly would. It is with me. I think if anyone's had an opportunity to come down on a Thursday morning at 8:15, I'm doing a plug now, for spotlights. So that's our patient first spotlight. Individuals or teams come along.
Is this just staff members or members of the public as well?
No, anyone can go down and listen to them. It's in the main foyer by the 2 screens, big screens on the wall by the League of Friends. And actually they present the work. They only have 15 minutes, but they present the work and show the improvement and what they've achieved. And we have had some fantastic real initiatives and real improvements, and we've been doing it for about 6 months now.
Can you give me some examples of those sorts of things?
We've had the infection control team working with a number of ward areas where they've had some issues, but actually they've really improved and done some excellent work around improving the environment and improving their knowledge around infection control. We had a presentation from the maternity area around supporting women that had difficult births and the mental health piece behind that. We've had another presentation around preceptorship, around for
I don't
nursing.
know what that means.
That's about like mentoring, supporting,
Okay.
newly qualified, etc. That's a fantastic initiative and needs to be rolled out across the organisation, not just in nursing, I think, but across the organisation to support people and really get them to settle in, if you like, into a new environment. One of the things that we look on a regular basis is about how many people stay over 2 years at the organisation. Because what we did see from some of our data previously is that we were losing people under 2 years of being here. That's actually slowed right down. And actually it's improved.
What would you put that down to? What are the reasons behind that, do you think?
I think some of it is about how we're trying to look after them as they come into the organisation. I think patient first is making a big difference. It's about being part of that team and changing things for patients. And I think the work generally that we're trying to do, you know, to improve performance, to improve the care that we're giving, I think, you know, people take notice of that. And if they're part of that and can contribute to it, it makes a big difference.
So it's really quite a lot about staff engagement.
It is.
So it's not, so is that perhaps, might you say, a bit more about them being so involved that they're kind of not managed from the top? Does that make sense? I don't think people like to be managed, do they?
No, but they need to have the autonomy within their own area to be able to do things. Obviously, we've got to have governance. We have to have that. But as I said, we've still got a lot of work to do. We haven't got it quite right for everybody. And I think the more work we can do, particularly with some of our networks, like the BAME network, a number of areas right across there, the better we can be. And that's my drive, is to be able to make sure, as I said to you, every member in this organisation is as important as each other.
Yeah.
No one is not important. We can't have that. So it's about how do we make sure that people feel this is the place where they want to be. This is the place where they want to work.
And this is a place where they have a future.
And definitely a future.
So is there a pathway for people to have promotion within the hospital, or do people feel as though they have to move outside?
I think sometimes previously, I think a lot of people left because of some of the structures, particularly in nursing and particularly in operations. I think they could only go so far, and then there was a big gap. Last September, we took the decision as an executive to actually change the divisional structure. So the clinical divisional structures changed. So we went from 2 big, massive divisions to 4.
Right.
And the reason we took it back down to 4, you know, I'm sure previously they were 4, or 3 or 4. But actually why we took it back down to 4 is so that people had time to do the job. Actually, we could get nearer to the front line, if you like, in terms of the structures. But also there's a real opportunity for real close ownership by the divisions about the work that they were doing. The 2 big divisions were too big. And within that, we changed the structures so that there are opportunities now for people to go up the ladder.
Yeah.
And I think that's made a difference in terms of not losing people. But we've got more work to do.
And what kind of training underpins and supports that? Has that changed?
Well, the training for qualified staff, this is about as they come in the door, have preceptorship, you know, mentoring, that sort of thing. I think it's important that actually as they go up the ladder, one of the things that we've been working with the executive and now also the divisional teams is about looking. So if you want to progress and at each level, what does that mean? What do you need to have?
Yeah.
We've actually mapped that all out and we will be publishing that very shortly. But actually I call it competencies, but this is about if someone wants to go from example, an 8B senior nurse, if you like, and wants to be divisional director of nursing, who's in 9. How do you get there? Well, actually, this sort of maps out some of it that you can actually, this is the sort of type of thing you need to be doing to be able to get to where you need to be.
And do you think the visibility of that roadmap, if I could call it that,
it's a bit of a roadmap.
Gives people the motivation that there is a future for them here rather than having to go somewhere else?
Yeah, I hope so. Okay. I think that's what we're hoping. Yeah. And also underpinning that is about, so what are we going to give them as an organisation? Support for courses or support for away days, that sort of thing, so that actually they can progress. I think it also, particularly for our medical colleagues, our chief medical officer, again, any new consultants coming into the organisation has an opportunity to join a cohort of other new consultants,
right,
that can actually then do some project work, but also a collective. It's a way of supporting them.
It's giving them a sense of community.
Exactly.
Yeah,
so actually that gives them something to sort of work to. But also it gives you the networks, because sometimes it's so easy to come in and stay within your own area, and actually you don't really know people outside, whereas this gives you a network.
Yeah.
And that's the same for nursing, same for AHP, same for ops. So hopefully this will be able to give a different perspective in terms of opportunities within the organisations.
Okay. How would you describe your management style? What sort of a manager are you?
That's interesting. Yeah, I can imagine what my lot would say.
Well, there's two perspectives. What do you think, and what do you think they would say?
I'm very down to earth.
Yeah.
What you see is what you get. Everyone, I think most people would say that. I am extremely passionate about patients and about them getting the right care, the right place, whatever you want to call it. I'm a bit of a control freak.
Are you?
Had to be if I was a chief operating officer. I think it's part of the DNA that you have to have in some respects. But they tease me in the exec team about the fact I have to sit on my hands. And I go, right, okay, so what are we doing about it then, rather than giving them the answer? And I think that is so important. I think a lot of people look to me as CEO as if I've got all the answers. I haven't. And I'd be really worried if I did. But, you know, it's one of those things. So I think I'm quite open. As I said to you, if we get things wrong, we own up to it and we do something about it. If we get things right, I want to celebrate it. I'm very passionate about healthcare. I wouldn't have stayed in it this long if I wasn't.
Well, I can imagine it's one of the more difficult career choices in terms of, challenge, I would think.
Yeah.
So how do you switch off? What do you do to switch off then? Because I don't know. I was thinking about your job, and I was thinking, would I like to do your job? And not on this planet would I like to do your job. No matter how much money you paid me, it would just be, I wouldn't want the responsibility that you have. And I think as an individual, I wouldn't be able to switch off, and I would just carry my work, and it would make me a completely awful person. So how do you switch off? Can you put this job down?
It is really difficult. It is very difficult.
I mean, the
to
responsibility is immense. These are people's lives,
is.
the beginning of life, the end of life, staff. This is really serious stuff. And that's what I was contemplating. And I was thinking, goodness me, I couldn't cope with it.
It's really interesting how you described it. And I think it's absolutely right. But I remember it probably was 3 months after I got the job. And that sense of, oh my goodness, what have I done? Yeah. This is my responsibility. Not that I didn't understand it, but I think suddenly, I'm
all of a sudden you're there.
You're there. I think you can't quite switch off. Even when I go abroad, the guys are very good here, but even then you're sort of not quite switched off as much. And you do hold that accountability and responsibility. And I think one of the things is, as I said to you, people expect you to know everything. It's all you've got to do it. And that's their expectation sometimes, and that's what you have to work with. But one of the things that I've learned over the last sort of 18 months, 2 years, is that I can't do it on my own, and nor would I want to. Mm-hmm. And actually, it's better when people around me are actually coming up with the solutions and finding different ways. My job is just to facilitate it and to help them. And sometimes we don't get it right.
Yeah.
And actually, what I've learned in the health service is definitely give people a break. They can't get it right all of the time. And actually, most of the time, it's not catastrophic, but actually they've done it with good intentions. There's not many people that I've come across in 41 years that haven't done it, that have done something that may have gone wrong, but actually they've done it with good intentions.
Yeah. Yeah.
And I think one of the things is about we've got to learn to be, and certainly from my perspective, is about we need to be kind to each other, because this is tough.
Because otherwise, I guess we have a mentality of punishing people where actually they don't deserve to be punished. And
I punished years ago in your health. That's how it felt.
Yes.
You know, if you got it wrong, the big hammer came down and it was really difficult. That's not how we work now, and it shouldn't be how we should be working. Yeah. So it is about being kind to people. It's about understanding where they're coming from. It's about listening. And I've learned that, you know, over the years, you've got to listen to people, what they're telling you, and you've got to understand sometimes the actions that you may have put in, how they've landed on people, because you may not have intended it, but that's how they view it. And you've got to take it on the chin sometimes to understand that. Yeah. And it is difficult. And I think the other bit is about respect. It's about respecting people. And so for me, it's making sure that in our organisation, we respect each other. But putting it down, probably not.
Well, what about preventing burnout then? I think that would be my big fear actually for me. Yeah. Because I know I've got the kind of personality that it's got to be all or nothing. Yeah. And I think if you're wired that way, how do you stop getting burnt out? I mean, I bet you see it in other people.
Oh, I do. Yeah. I do. You do. And sometimes you've got to recognise it really quickly sometimes. But yeah, you do. And the pressure that you're under. I've got a very supportive family. And that makes such a big difference. You know, I can switch off, if that's the word. When I have my time at home, that is so important to me, really important. I think it's also trust, isn't it? About whilst I may not switch off completely, I have to trust the team around me and the people around me. And that is so important. And I trust them. Yeah. You know, that's what I'm saying. And I hope they know something goes great. It's wonderful. It's not quite right. You know, we're not going to hang you out to dry 5 minutes because that's not what people are about.
Because if your intentions weren't good, you wouldn't be here anyway.
No, well, do you know what? That's most people I know. Yeah. There's very few that I could pinpoint in all the years I've done this that intentions were not good. So this is just learning that through. So I think my family definitely.
So what do you do to have fun and to switch off?
What do I do?
Yeah.
I run.
Oh, do you?
I know people won't find that fun, but I actually run. I run I did 10K at the weekend. That's the most I'll do. Can't do any more. I'm getting too old for that. I enjoy exercise and stuff like that. So I do that quite a lot. I love going out with my family and doing things. My husband's had to put up with me for all these years. He's nothing to do with the health service. But I think he probably knows as much as I do now after all this time. Yeah. But, you know, it's important to get that downtime with the people that you love. Yeah. And the people you want to surround yourself with. So, yeah.
One of the things that James told me when I interviewed him was he said it was so difficult to go to the supermarket because everybody knew who he was. He said, I can't go into a supermarket and do my shopping without somebody coming up to me and sharing an experience that they've had or a question that they've got. Yeah. Do you have the same issue? Or do you send someone out to do the shopping?
Not quite so much because I don't live up here. And I'm not going to tell you where I live. Most people do know where I live. But I actually don't live up here. Okay. I travel about an hour and a half to get to work both ends, you know, to about 3 hours a day. But I do that because I love the job. And I do stay up sometimes, but I don't actually live locally. So there is some benefit to that.
Well, I imagine so, yeah.
Yeah. But so it's slightly different.
But you must be fairly familiar with the area.
I am familiar. Here? No, I'm from Sydenham. Okay. That's where I was born.
Right.
You can hear the accent. South London.
Well, I'm from across the other side of London. Is there anything else that you wanted me to ask you that you wanted to share with us?
I think it's important. I want people to, whether they're patients or whether they're staff, to really feel that this is their organisation and that they are a part of this organisation and they've got a contribution.
What could the general public do more of or do better of to support you and the hospital staff and the way it runs? I mean, I presume you feel that we have responsibilities as the general public. What is it that we could be doing more of or less of, perhaps?
I think there is something about taking the opportunity, perhaps think if, in their eyes, they feel unwell, of course, if they are really unwell, then they should pick up the phone to the ambulance service or they should bring themselves into ED if they really are, if those really serious things. But I think sometimes I've got a painful foot and I've had it for 3 months sort of thing, actually consider what other options there are out there. And I think that would be good. I think the other thing is supporting the organisation, when we do certain Fundays and things like that, and really supporting, because I think the staff really appreciate that sort of thing.
And how do we find out about what's going on and what support you're looking for?
Okay. Now, we often put out on social media what's going on.
Okay.
We try to celebrate the teams that are doing really well.
I've seen a lot on Facebook about recognising the good job that's been done by your staff members.
Yeah. And I think that's really important. So picking up in social media around things, that's really important. We'll often go to some of the big Fundays, that are out in Medway and in Swale. So if you see us out there, come and talk to us. They could, if they're feeling up to it, they could volunteer. Mm-hmm. I went to the volunteers tea the end of last week. We've got 91 volunteers. Amazing people. One lady had volunteered for 25 years.
Goodness.
That's a huge amount of times, but lots of others have done 5 years, 10 years, 15 years.
Well, I need to give a little shout out for our Eunice, who's the chairman of Hospital Radio Medway, because she's been here 50 years.
Oh my goodness. Whatever it is, a long time.
Yeah.
So, there's opportunities if people have the time to actually come and contribute and see what they can do. So very open to any of that.
To listen to more episodes or find links to all of our programmes and videos, visit hospitalradiomedway.co.uk. You've been listening to Chatterbox.
There's 4 easy ways to listen to HRM FM. Go to our website at hospitalradiomedway.co.uk and click to listen now. Go to NHS Wi-Fi on your device and find us there. Say,
play Hospital Radio Medway
to your smart speaker, or switch your radio on and go to 87.9 FM, the radio station for the Medway Maritime Hospital. This is HRM FM.